everybody, my name is Julia Gaines. I'm the Supportive Programs Manager here at COTS. COTS stands for Committee on the Shelterless. We're here at Mary Isaac Center. This is our home base for COTS. We're located in Petaluma, California. We have an emergency 80-bed shelter here, as well as other programs such as supportive housing, rapid rehousing, rental assistance, and we also have Mary's Kitchen here that serves free meals every day to the community. About 60,000 meals served last year. But of course, what's the newest, one of the newest programs that we have is our Recuperative Care Unit. So I would love to take you upstairs and let's go take a look. All right, so here we are on the second floor at Mary Isaac Center. This is the home to a lot of our case management offices. This is a permanent supportive housing here right next behind me, and this is our Recuperative Care Unit. So let's go inside. I'd love to show you around. All right, come on in. So our Recuperative Care Unit is 6 beds, it's co-ed. Basically, recuperative care is also known as medical respite. It's used for people that are coming out of the hospital that are homeless. And where they would be discharging home, they don't have a home to discharge to. So recuperative care is a place for them to come, heal from illness or injury, perhaps they just had a surgery, and they just need a little extra time before going down to the main shelter or wherever it is they're going next. The hospitals are our partners, they're our funding partners for this program, and this gives them a place to discharge their patients that are homeless and then don't have anywhere safe to go. And it also helps with getting services here at Recuperative Care that you don't return to the ER as much because you learn how to be more self-sufficient and manage your own health care. So we got 6 beds here. Everyone has their own lockers. We give them a couple lockers. They can also store things underneath their bed or in their nightstand. When they arrive, we do a full intake procedure, and it includes giving them towels, their beds made, we give them some toiletries as well. Leave them all our business cards so they can get a hold of us at any time. And so people typically stay maybe anywhere from a couple weeks to a couple months. They have a varying levels of ability, but pretty much everyone needs to be independent with their ADLs, which is activities of daily living. So they need to be able to feed themselves and bathe themselves, get downstairs to have dinner in the dining hall. So they need to be fairly independent, manage their own meds, but we're here to help them with coordinating their health care and helping pick up their medications, etc. Just to kind of give them a good start right when they get out of the hospital. So if you come this way, this is the office in here. There's a recuperative care specialist here 7 days a week. Not that these people, not that the guests here need to have, supervision 7 days a week, but it's nice to have someone here to be an assistant and to help them with whatever they need. We have a medication fridge. This is for meds only, so if they have insulin for diabetes or anything else that needs to be refrigerated that's prescribed, we can keep it in here. Small kitchenette area, although we don't allow food in recuperative care because it can get a little messy. And then right behind you we have a couple cupboards filled to the brim with blankets, pillows, towels, a whole bunch of wound care supplies, vital signs equipment, just kind of whatever we need to keep people comfortable and monitor their health. So coming this way, we have a ADA compliant bathroom, very exciting. So it's pretty much a one-person bathroom. We do have a shower that you can get in with a wheelchair, then a bench, just if someone can't stand for very long, large restroom stall, and a couple sinks. It makes it easier, especially if someone has a wheelchair or a walker, just to get around and do what they need to do in a comfortable, spacious area.
Hi, I'm Angeles Cruz, or Angie, and I'm one of the recuperative care specialists here at the COTS Mary Isaac Center Recuperative Care Unit. So the main purpose of COTS Recuperative Care is for patients to come and recover from acute medical need that they may have. For example, they may have a wound or be recovering post-surgery. So if a client can recover from something acute within 2 weeks to max 2 months, which is the time period that we typically allow patients to stay based on their medical needs. If they are eligible in that sense, That's one of our main requirements. They are welcome to come to our program if we have the bed availability at the time. And so when an intake is scheduled, they must come with 2 weeks supply of medications, a follow-up appointment with a primary care provider, home health if they need it, and a negative COVID test within 72 hours of the intake. And all those things are put in place to make sure that the patient is set up for success before they come from the hospital or skilled nursing facility. So our role is primarily as case managers. We do a lot of the healthcare related work, which is important in respite care, but our main role is case management. So while they're here after their intake, within a couple days, we do an individualized action plan, so what they would like to accomplish, what their goals are during their stay, and that is a holistic perspective on the person's well-being. So it's not only physical health, mental health, but it includes housing, finances, any legal needs, recovery if that's something that they're interested in or participating in, etc. The stay, like I mentioned, can vary from 2 weeks to 2 months based on the individual's needs. So it's a quick time for some individuals, so we prioritize getting an ID if they need one, a social security card, setting up any kind of health benefits, and Medi-Cal, Medicaid, all those things, as well as EBT, food stamps, anything that they would primarily need in order to get set up for housing, which is the ultimate goal for our individuals. And while they're here, we do help assist them finding all their alternatives after the recuperative care stay. Most clients do go downstairs to our main emergency shelter, but that's not everyone's plan or not everyone's desire, so we work with the clients to make sure that they ultimately have the final say of where they would like to go or where they would like to end up. And we do give a warm handoff to the clients that end up downstairs, making sure that the next case manager has all the documentation and knows the client as a whole and assist as necessary as well. So just because they leave our unit and go somewhere else doesn't mean that the connection doesn't end. We want to make sure that the clients have their success and are able to share that with us as well.
All right, well, I am sitting here with Mr. James Kennedy. He is currently a client here at Mary Isaac Center in our recuperative care unit. And I just wanted to introduce you to him and you talk about his experience here. Hey,
How you
James.
doing?
Good.
Thanks God for being here. Thanks God for the lady that sponsored the shelter that let me in here, to the peoples up here on this floor, Miss Juliet and Jill and Winston and them, how they got me going the way I am right now. Before, when I first came in here, I couldn't even walk. So that's a blessing. I couldn't stop on my own little 2 foot. Some little ladies had to really tote me around. So you can say that who cares for people who don't care, they go above and out their way to get you there. Now I can walk, I can kick, I can run a little bit, and thanks God for that, because I haven't found any other place to do what this place have done, or any other place to do what these ladies here have done for me. These three ladies take me to hospitals, take me to doctors, and got me walking baby just like a baby machine. And you can't ask for it no better than that.
So let me talk a little bit about medical respite and why it works so well for our community and for our shelter. Our unit opened just about 2 years ago, and since then it's been about 50 people that we've served in the last 2 years. Most of them have come through and gone down to the shelter, but you know, if they went straight to the shelter, they probably would have ended up right back in the ER, because they just weren't ready to be in a congregate living environment. They still needed assistance with medications and activities, and recuperative care just provided this kind of soft landing out of the hospital that gives people time just to get their strength back, and then they move on to whatever their next housing situation is. It's been an absolute game changer for our county, our community. The hospital partners that fund this program have been very happy with the results in terms of people aren't returning right back to going to the street and then returning to the ER 24 or 48 hours later. They're staying out, they're learning how to manage their own health care, get established with a primary care physician, pick up their meds, take them regularly. All these things that seem really simple to us are very complex for a houseless individual. It's hard to get regular health care. if you don't have a shelter. So this has made a big difference in a lot of people's lives. I would love to see us have many more beds than 6. 6 has made a big difference, but certainly if we had a larger space, that would be wonderful. We are one of 2 respites in Sonoma County, but the only one in South County, in Petaluma. So, we work primarily with Providence Hospital, and they would love to see more beds, more spaces to discharge their patients too. All right, well, thank you so much for watching today. It was such a pleasure to give you a tour through what I feel is just one of our most amazing programs here at COTS. If you'd like some more information about our services and programs here, you can go to cots.org. If you have any questions about medical respite, our experience, and how it's helped our community, I would love to talk to you. You can reach me at recuperativecare@cots.org. All right, thank you.